Okay, so good evening, everyone, and welcome to What I Did with My Degree. My name is Uma, and I'll be graduating this spring. And the degree program I'm in is currently Epibios. And yeah, so tonight we will hear from public health professionals and CUNY School of Public Health alumni who hold degrees in epidemiology and biostatistics, as well as population health informatics. Before I begin this panel, I want to give context to both degree programs here at CUNY SPH. The Master of Public Health in Epidemiology and Biostatistics prepares students to design and conduct public health research and apply findings to improve the health of populations. Students also gain an understanding of and learn to apply core and intermediate level statistical methods to public health research data management, statistical analysis, interpretation, and presentation of analytical results. Population health informatics addresses the growing opportunity to use technology to implement evidence-based solutions for the improvement of population health outcomes. While most health informatics programs take a hospital-centric approach, this innovative first-of-its-kind program focuses on how to operationalize informatics solutions to address important public health challenges impacting individuals, families, communities, and the environment in which they live. For more information, visit the CUNY SPH website. So tonight's panel will include moderated questions followed by a Q&A. As a reminder, you are able to move between this breakout room and others at any time. The chat is open for any comments or questions you guys may have. So now we're going to hear from a panelist. Each panelist will introduce themselves and just share a little bit about what their role is and their responsibilities. So Carmen, if you want to start us off or introduce yourself.
Good evening, everyone, and thank you for being here. My name is Carmen, and I graduated from the MPH in Epi and Biostats in 2017. And I'm currently a PhD candidate at Harvard School of Public Health in the Biostatistics department.
And I just wanted to quickly ask, what motivated you to continue your education after receiving your MPH and being in the workforce? What did you hope to achieve once you graduated?
Once I finish my PhD, I'm still 3 years to go, but my goal, well, initially I wanted to stay in academia, but the more research I do and the more work, realize so I'm in the PhD program, and I'm in the training track for like creating quantitative methods for cancer research. So my end goal is to work at a medical center. More specifically, I want to work in a cancer center. So right now, I live in Boston, and I'm affiliated with the Dana-Farber Cancer Center. So my end goal is to get a job there as a principal biostatistician. So yeah, that's what I'm working towards too. But like my interests are more in cancer research and health disparities, data science, machine learning world.
Wow, very cool. Thank you so much. Next, Rafaela.
Hi, everyone. My name is Rafaela. I am one of the first graduates of the Population Health Informatics cohort back in 2021. So one of the things that I'm currently a value-based payment coach at NYC Health and Hospitals, and there I'm helping to address risk score improvement for the facilities. I'm working with both Queens and Elmhurst Hospital. So like I said, working on risk score improvement, working to address care gaps among patient populations, working on patient retention, making sure that we're able to keep patients within H&H in order to improve population health outcomes. Some of my tasks are helping to design, develop, and implement evidence-based interventions to address care gaps, outreaching to patients to make sure that these patients come in for their appointments, and providing education to providers and residents on the importance of risk score improvement to help outcomes for our patients.
And Rafaela, as a graduate of the first cohort of the Population Health Informatics degree program, and the founder of the Population Health Informatics Innovation Research and Education Club. What advice do you have for current students in the degree program who might be struggling with their next move? How did you utilize the skills that you gained at CUNY SPH in your own public health journey? Like, can you?
Yeah, that's a great question. So one of the things that really gave me a platform from the get-go once I started at SPH was trying to find research with one of the professors. Dr. Joshi, he was the one that created the PHI program, and he gave me the opportunity to work with him for 2 years. And in that opportunity, he ended up becoming a mentor to me and really gave me kind of the skill set I needed to really advocate for myself in the field. And I think one of the things, if you're interested in looking to pursue a career in informatics, that informatics is not limited just to healthcare settings. It can also be applied to education settings, to a business setting, because it's really just using data, information, and knowledge to inform and drive change. This could be using data to drive evidence-based interventions and improving workflow processes. For one, to improve health outcomes, but really to provide accessibility for all.
Yeah.
And in my current role, I was working on rolling out an intervention with collaborative drug therapy management pharmacist, CDTM. And one thing that Dr. Joshi, always emphasizes, it's not about, learning all of these programming languages. Like, it's great that you have them under your belt, but you should never let the programming language drive you. You have to drive the data, and, really just approaching data analysis, simple, clean cut, and you can learn the heavy skills afterwards.
Absolutely. That's very true. I completely agree with that. That's awesome. Thank you so much. Up next, Marco, would you like to introduce yourself?
Yes, of course. I'm happy to be here today. My name is Marco. I graduated from the Epi and Biostat MPH program in 2021. And I work as an associate in research at Duke University at a research center that is called the Center for Latino Adolescent and Family Health. And at the center, I support sort of all aspects of our research across the entire research process, from development, submission of grant applications to once we obtain funding for studies, kind of study setup, training and hiring of staff, and dissemination of findings from completed studies. And I'm involved with kind of training some of our newer staff members at the center, and I'm actually based in New York, while sort of the center is in North Carolina. So I'm coordinating some of the sort of New York-based activities that we have.
And Marco, so what first sparked your interest in public health and specifically epidemiology?
So I think for me that was a little bit of an unconventional journey, because I'm originally from Germany, and I did my undergrad education also at CUNY Brooklyn College, and I wanted to stay in the US, so I needed a job after I graduated. And I originally did my undergrad in economics, and I didn't know much about public health or epidemiology, and I couldn't find a job at the time. And in the end, I found a job at the center where I work now, the Center for Latino Adolescent and Family Health, which at the time was at NYU. And that was really my first exposure to the field of public health and research.
Mm-hmm.
And I started to work there in sort of an academic setting, full-time research. And that was prior to my decision to do an MPH and enter the field of epidemiology. But I sort of realized, being involved with the research at the center, that epidemiology, out of the sort of more interdisciplinary research that we were doing, there's the area that interested me the most, social epidemiology, and that kind of led me to decide to pursue an MPH. And I did that while continuing my work at the center. I did it at CUNY, and it was a great experience, sort of applying back and forth what I learned in the program at work and what I would learn in the program at work in the program.
So, in regards to CUNY, how did the school specifically impact your career trajectory, and what do you hope to accomplish in the long term?
I mean, I think it was a big change for me working just the job and not kind of learning on the go versus then entering the program at CUNY and really learning some of the methods more systematically in a classroom setting. It helped me a lot at work. And then I also feel like what I had learned or what I had exposure to at work or helped me at school. And I mean, it's full-time work and doing an MPH is sort of a lot, but if you can cross-apply what you do, it makes it a little bit easier. For example, I was able to do my field work at the research center where I was working, so and there was those opportunities. And I am looking to stay in academia for sort of the foreseeable future. I want to pursue a PhD, and I'm probably gonna start one this fall. I don't know yet where, but I
I'm
hope
sure
I
you'll
will be
figure it out.
able to start. And yeah, that's sort of the next steps at this point.
Very cool. Awesome stuff. Thank you so much for sharing. And last but not least, David Goldfarb, would you like to introduce yourself?
Sure. Thank you, Emma. And it's really great to be with you all today. My name is Dave Goldfarb. I actually received my doctorate in environmental and occupational health sciences from CUNY last May in 2022. But I took several classes in the Epi and Biostats department. I also have an MPH in Biostats from SUNY Downstate, which I got in 2016. Currently, I'm a senior epidemiologist at Montefiore Medical Center. Our group investigates some of the health effects from the 9/11 disaster. A lot of my work has been centered around oncology and advanced lung disease, advanced respiratory disease in the 20 years since the attack, or 20 plus years, I should say. I also have experience in private sector. I worked for Regeneron, and I supported their solid tumor franchise. And yeah, it's great to be part of this great panel.
So similar to Carmen, you made the decision to continue your education and you obtained your PhD in environmental and occupational health sciences at CUNY SPH. What was your motivation in picking that specific degree program for your doctoral training after obtaining an MPH in biostatistics?
Yeah, it's a really good question. I think when I was doing my master's, I was really just taking things kind of a day at a time. Was also working at the same time, so I was quite busy, and really didn't actively think about pursuing a doctorate at all, to be frank. But maybe it was something in the back of my mind. Shortly after I graduated, though, I started to explore my options, and I benefited from having a lot of great mentors, and they kind of pushed me in that direction. Having worked with the World Trade Center program, I was interested in kind of understanding both sides of the equation, like the antecedent, the exposure, and also, the health outcomes. So I applied to a lot of programs, and CUNY just seemed like a really good fit. I really got a good impression when I interviewed, and I really enjoyed it. And I had, again, the opportunity to interact with both people in the EOHS track, but many also in the EPI track as well. And I learned a ton, and I learned a lot and expanded my methodological knowledge. It was great.
Wow, that's awesome. So our panelists have already left us with a lot of important information, and there's still more to come. I believe Taylor is looking at the chat, but if you guys have any questions, or if you have any registered questions, if you have registered any questions, we've collected those questions, we've collected some, and our panelists will get a chance to answer a few. So to any of our panelists, one question that I wanted to start off with was, what has been the best piece of advice you've received throughout your journey in public health? David, I know you said you had like a lot of great mentors along the way. Is there someone that like said something to you that like stuck out, that inspired you to like get your PhD?
to get my PhD, it was a number of mentors, both at work and for my master's program. I guess just regarding general advice, it's going to sound cliche, but just kind of stay focused. And also another cliche, not letting like perfection be the enemy of the good. So like when I was doing my dissertation, there's this temptation to do every analysis possible, and it becomes your baby, for lack of a better term. So, you want to do, the data better than anyone else. You want to do all these fancy analyses, but the end goal is to learn a lot and also to, stay focused and finish in a reasonable amount of time. So, it might sound sort of cliche or trivial, but I thought that was great advice. And my advisors at CUNY really stayed true to their word and helped me get through the program relatively quickly.
Absolutely.
If I can add something,
Mhm.
Dr. Joshi might have, said a lot of philosophical things to us when we were, in the program. And one of the things that really stuck with me was that he said, we have to grow like a tree. A tree usually grows upward, but a tree should be growing like its branches straight away, so like to the side. Because if you grow to the side, you have the chance of an opportunity to support and cover for others and provide like shade. So that's something that really became a core belief for me in this like public health journey. And I'm very much about connecting people, passing that knowledge forward and building that community, because I know it's really easy to just kind of get lost and just, keep your head down. So I'm very much about facilitating that exchange between peers in order to help each other out.
It's great advice. Okay. Does anyone else, any of the other panelists have anything to add?
I guess I'll say this is something I have to constantly remind myself. Like, I'm a second year in this PhD program, and like I'm just starting to do research in the program because we have to take a lot of coursework. So I'm finishing coursework and I'm doing research, but I think something that like the professors I'm working with, and even before when I worked at Columbia, just doing research, it's like to not lose sight of the goal and the impact of your work. Because I feel like, at least for me, like I do a lot of math. So sometimes I get lost and frustrated with the math and the coding. And like if I'm working on an algorithm and it's not working. So sometimes, just take a step back and kind of look at at what you're doing from a different perspective, and like how, like kind of like the change that we're making, because we're public health practitioners, like we are making change, and just kind of realizing that your work matters. And like at the end of the day, you're doing this because you care about it and it's something that you enjoy. I have to constantly remind myself this because it gets hard, and I'm literally at the beginning of my PhD path. So
Yeah, that's awesome advice. So specifically, or actually anyone can answer, but what are the few skills that you gained from your MPH that you are using today at your workplace?
I think in my case, a lot of the just kind of technical and methodological skills in terms of study design and various kinds of statistical analyses, etc., are just, if you're interested to stay in the field of epidemiology, which is sort of more my field than biostatistics. I think others can speak to that better. But if you're interested in that field, then all of those foundations that you'll learn in the program are essential, in kind of a job environment. And I would say that's what I use most.
Mm-hmm. Absolutely. I even think in my experience, when I went into the program, I was just looking at epidemiology, and I wasn't really, I kind of doubted my computing abilities for coding. And I didn't realize how intertwined epidemiology and biostatistics were when I first, looked at this program. And I just remember kind of second guessing myself. And because I second guessed myself, I almost decided to change my concentration because I was just unsure of my skill without even really trying. I decided to just, take a leap of faith and I was like, all right, this is something that I'm capable of doing. It's not like everyone went into this program knowing how to code. There were people that, never even did Raspberry Pi, and I had that over them. And that was like when I was in my bachelor's program. So that was like one thing that like I remember feeling, just kind of that self-doubt. And it's like one of those voices that like you got to repress, or you got to just like talk yourself out of it and like take that leap of faith. And I feel like it's kind of like you always have to do that with everything in life, but especially with your career, and school and your education. Like you can't be afraid, you got to be confident, like moving forward. So that was just like something that kind of like popped into my head when you were speaking, Marco. But yeah, very kind of like one of those things, like we can't let anything really, like our own self-doubt, stop us from whatever it is that we want to accomplish. Like we have to at least try. But yeah, sorry, that was my little anecdote. Another question that I have for you guys is, what would you say has been the key to your professional growth?
I think for me, and I think that's something that may be important for many people who are at the sort of start of their professional career, early career folks, that you want to try to look for a mentor where possible, and really step outside of kind of your comfort zone in selecting your mentor to the degree where you have kind of choice. But it's not always the best choice, in my experience, to have a mentor who is just supportive and just kind of gives you the positive and reviews your work and says, "Oh, you did a great job." Because chances are, in most of our work, the first draft is not always the best one, and you want someone who points that out to you and pushes you to, improve on the second draft and improve on the third draft. And really, obviously, you want to have sort of a personal relationship and support in that regard. But you want to select a mentor, if you can select one, that won't be afraid to kind of push you to improve, and doesn't just tell you, great job, keep going, because you won't do your best work that way.
Absolutely.
Yeah, I would completely agree with Marco. I think mentorship is critical. I also would say that, the onus is sometimes like on the student to, seek out what your research interests are and seek out the faculty that's, that aligns with your research interests. And like for me, I was very shy going into my program. And then I took it upon myself to just start emailing the different faculty. And I could promise you from experience, they're very approachable. They're very nice for the most part. So, they'd be more than willing to either work with you or point you to someone who'd be willing to work with you. And that's such a key factor, especially because I know like a lot of the programs is moving towards like a virtual format. So, just even making, asking for a Zoom meeting or, emailing, interacting that way. It was very helpful for me.
Yeah, absolutely.
I would say that for me personally, it was really being open to new opportunities and advocating for yourself when you have a good position, but like how can you make this good position a great position? Sometimes the current role that I'm in initially was not really data heavy, and I was telling my manager, if there is any work down the pipeline that can be more data heavy where I can use my informatics skill set, please add me to that. So being able to leverage the degree once you come out of your job and looking for that opportunity where data can be involved is also key, because a lot of the folks on the team you'll be working with are not going to be so data savvy or tech savvy. So it's an opportunity to really bring what's important: data integrity, reliability, infrastructure, and even to extend in my own facilities data advocacy, because sometimes there is that mistrust of the data they're working with. So I really am trying to pioneer what I can do there. And I feel like with my background, it's really been a great asset for the team.
Yeah. So I just wanted to ask Raphael while I have you. Did you imagine yourself in your current role? Because I know that you were one of the pioneers for the pop health program. So did you know what you wanted to do with your degree once you graduated or even before? Is this the role that you thought you'd be in? Or if not, how does your current role differ from like what you do now?
Yeah, it was a crazy ride. I initially applied for the master's in Epi program and I got rejected. So then prior to that, I invested a year doing the certificate in public health. So that's already like 15 credits. So I was like, okay, I can't lose those 15 credits. What can I do? Luckily, the population health informatics program unveiled the semester before, and that really changed everything for me. Like it's been such a great opportunity to be a part of that. And initially, I always knew I was like, prior to doing the master's degree, I was working in healthcare. I was working in primary care offices, neurology offices, and I saw from like the patient experience perspective that I wanted to improve the experience for them using technology. Like I wanted to leverage technology to make it easier for them to access their healthcare needs. Once I graduated from the program, I got the opportunity to work with NYC Health and Hospitals, now looking in at the provider lens. So now giving providers the tools to better, see their patients, how to address their risk score so the facility can get more revenue to provide support for the patients they're taking care of. So it's not a straight line. Like you think it's going to be a straight line. It's not. Your path can go in a million different directions. And I don't know if I'm going to stay here for a long time, but for now I'm enjoying what I'm doing, and it's really interesting. So I'm glad for the population health informatics program. It really gave me a great stepping stone.
Yeah, absolutely. Did anyone else have a straightforward path, or did you know like right out the gate that you were going to be in this position? Carmen, I see you shaking your head.
No, like far from, honestly, like thinking back at what you were saying, taking a leap of faith, that's how I got here. Because so my background from undergrad is math, and I was math and pre-engineering. So my plan since high school was that I was going to be an engineer. I was going to be a biomedical engineer. I ended up getting into a master's in biomedical engineering at NYU. And I went for one semester. And when I got there, and the thing was like, I had been preparing for this, but had not formally taken like engineering courses. I just liked the idea, and I was like, yeah, like I'm interested in like biomaterials, like developing like medical devices and all. But it was like all in my head, really. Also, I was very young. Like I graduated undergrad at like 19, so I was like still like exploring. So I went to NYU, and when I got there, I realized that I hated it. And like 2 years before that, I had done an internship at Columbia in the biostatistics department. It was just like a summer internship. I did a little bit of research throughout the summer. And I mean, I got introduced to biostatistics, which honestly, now, like looking back, I wish I had known about like statistics like since high school. I mean, it wasn't like a thing before, like Epi, biostats, and that kind of makes me sad because I feel like I would have gotten here sooner. But yeah, so I ended up quitting the program at NYU, and like I just started reaching out to everybody that I met at Columbia during that internship program. And I ended up working just doing interviews. They needed people to recruit for them in Spanish for their studies. And like I started working like that, just like recruiting, just like doing some like data cleaning here and there. And they ended up hiring me. And then I was like, like I kind of like this like public health, epi, biostats. And then I applied to the program at CUNY, and like I immediately started. But like I just kept changing because I was like, I knew I wanted to do something that kind of intersects like math, science, like biomedical research, but like I couldn't figure out like what that was. And I mean, biostatistics ended up being a perfect fit for me, but like it was really a roller coaster ride, and it was a lot of like taking leap of faith, just like leaving a program and then being a whole semester without like no job or like really like nothing to do. And I was working, like when I was doing the recruiting, it was all volunteer work. So I was like working for free for the experience. Which back then, for me, like I was like, yeah, like I'm learning a lot. But nowadays I always say like, yeah, like you're working for the experience and you're a volunteer, but like still try and see if you can get paid. Because again, like we're grad students.
Yeah.
But yeah, not a linear path at all. I jumped around, but I am so glad that I got here.
Yeah, and I don't know if this was prior to this, students coming in, but there's, I don't know, I keep on mixing you guys up a little bit, but there's someone that's currently getting paid, or you guys were getting paid during your research for something, and then you did your independent study. Is
That
that?
was me.
Yeah. So you kind of figured, you found your way, and you kind of figured it out.
Yeah. Yeah. So I once I started working at Columbia, I like as an RA, I
Mhm.
stayed there all throughout like my MPH. And during my MPH, like I think I just needed like more credits to graduate. I can't remember what was the reason, but like I just reached out to faculty in the department, and I ended up doing like an independent research project with one of the professors. So it counted as like credit hours. But I also counted as a part-time job, like an internship. So I got like paid and got my credits. So like, I don't know, just like reaching out to faculty and seeing like any projects that they have, because there's a big chance that they just have a lot of projects pending and they just don't have people to work on them. So just like reaching out, like small projects for the semester that who knows, like they can become a paper. Like my master's thesis, like I published it. It was like my first authorship publication. And it was like that, just like working with people and reaching out. And again, like advocating for yourself, because
Yeah, absolutely. It's never straightforward. We always kind of, I know one of the other panelists, David, it might be you started off studying economics, or was it you, Marco?
Yeah. So, I mean, very similar to Carmen. I went to college and I had a degree in economics and chemistry. I thought I was going to be a dentist. And I applied to dental school. I didn't get in the first time, took a gap year as a research assistant, was doing, bottom, I don't want to call it bottom of the totem pole. It's very important work, but like IRB stuff, consenting people, just administrative tasks. At Montefiore, expressed interest in some of the analytic work, pursued an MPH instead of dental school in biostats, started to get more and more comfortable and more familiar with the work, parlayed that into kind of a job as an epidemiologist, and I was a junior epidemiologist there, and the rest is history. I tried, I applied to doctoral programs after I finished my master's, and here I am today. So
Yeah. And Marco, same thing. I think a lot of us kind of had this journey. Do you want to share a little bit about?
Yeah, very similar, I think, for me as well. I did economics undergrad. I was sort of under the gun to find a job because of visa issues, and I kind of got into public health that way, and then figured out that I actually thought it was very interesting and that I liked epidemiology, and then I pursued my MPH. So similar story.
Yeah. And you guys can correct me if I'm pronouncing your names a little funky, but Sumaya said that she's a dentist, or they're a dentist, and they think that you made a great choice. So not bad.
it's funny. For those of you who have taken classes with Dr. Burrell, she has a dental degree. I think that was her first career. And then, her and I always, kind of laugh about the fact that we both pursued research after. She actually went through with the degree though, and then before doing her PhD.
Yeah, it's kind of one of those things like we always have this vision for ourselves when we kind of, I guess, even going into our bachelor's, like what we want to do. And you end up being someone else completely. Like, I don't know, life just kind of takes you on this ride. But even for myself, I went into my bachelor's. Think my parents told me like, oh, you got to be a doctor. And I just remember them saying that and repeating that to me every other day. Like, you got to study biology, be a doctor, blah, blah, blah. When I told them I was switching to public health, they were really salty about it and they had no idea what it was. Even I was just learning, and this was, I did my bachelor's in 2012 is when I started. So I just remember telling them, and they were like a little disappointed. It actually took the Ebola outbreak for them to be like, oh, this is a good degree. So I guess thanks, Ebola. But like I just never saw myself kind of doing what I'm doing now. And I feel like that's the case for nearly almost everyone I've met in public health. So yeah, c'est la vie. Okay, so and you guys in the that's anyone that's here, if you guys have any questions, feel free to raise your hand, chime in if you want to share. Wilson, I don't know if you want to unmute yourself and speak. I know you just put something in the chat. I can pull it up.
Yeah, sure. Thank you. It's been really, really enjoyable getting to hear everyone's story, and really helpful too. I just started my first semester here at the program, so this has been excellent. I typed it out here. I'll try to act like I'm not reading it directly verbatim from what I said, but Carmen, especially, I loved hearing your story. And I'm in kind of a boat where I'm interested in the biostatistics concentration. I work for Weill Cornell in their population health sciences, and I know some of my colleagues are research biostatisticians themselves. But I'm thinking about, if I wanted to go into that, what the career trajectory would be, and if there is sort of a ceiling in terms of where you could continue to grow. And PhD would be something that would be important to, sort of add to your belt if you wanted to continue to lead, or especially getting to that place where you could lead investigations. And also if anyone else had input too. I'll mute myself now.
Hi, Wilson. Thank you for your question. Well, if you want to lead research, definitely you need a PhD, right? If you want to be a principal investigator, come up with your own research questions and your own methods, definitely. I mean, there's not really a cap. I don't want to say for anything, because I feel like you learn something new every day. And I think biostats is such a flexible field that it's not only public health. You can use biostatistics, the skills are transferable. You can do, I don't want to say you can do anything, but there's some you can do so many things with the skill sets that you get from just biostatistics training. So it all depends what your interests are. And I don't know, if you decide maybe, okay, I'll stay in academia for 3 years, and then after you're yeah, I'm gonna go into industry now. That's how I feel that's how flexible the career is. You can always be moving and doing different things. And data just keeps growing, and that just means more job opportunities for us too, which is great. But yeah, I think if you're interested in designing your own studies, creating your own methods, definitely a PhD. And also higher paid when you have a PhD in biostatistics too. Because at a master's level, which is kind of one of the reasons that kind of motivated me to go for the PhD. So when I worked at Columbia, so I worked all throughout my master's degree in the epi department. And then after I graduated, I stayed on from for almost, I think I worked there for almost 7 years, master's, and then until I applied for this program. And I just switched roles throughout the time I was there. And at the end, I ended up being a data analyst, but there's so so much you can do with a master's. Yeah, you can analyze the data, though you work with many people and collaborate, and be in a multidisciplinary team and learn from so many people from different fields. But at the end of the day, you're just doing the data analysis for them. Maybe you're writing parts of the manuscript or something, but it's not your research idea, it's not your study, right? So I think that's what pushed me, because I was like, I wanted to be my research idea. I wanted to be my study, like, because I had all these ideas, and like without the degree, I just couldn't carry them out. So that kind of pushed me to like be here today. Yeah.
Thank you. That was really cool. And really helpful to understand like sort of your thought process to ultimately decide to go back and pursue a PhD degree.
Yeah.
Kit, if you want to speak up or unmute yourself.
Yeah, hi, thanks, Zuma. So this question is more for David or for anyone who wants to answer. I am just finishing up my fieldwork at New York City Health and Hospitals and was just offered a position building out a quality improvement framework. My background is in economics. I'm an HPAM student and I wasn't able to be here yesterday, unfortunately, so I have to go back and watch the recording. But I was just curious on what made you decide to pivot from healthcare to the private industry, and what kind of distinctions you see between the two?
Yeah, it's a really good question, a really important question. I only had exposure to academia my whole life until recently, and I wanted to, at least try out industry. There's many advantages, some kind of quality of life advantages to industry, and then some downsides when compared to academia in terms of flexibility, in terms of your hours. It's very fast paced, but for my personality, I thought that was a good kind of fit. In academia, there's a lot of like kind of hurry up and wait sometimes. And the pace, especially for people who are wanting to accomplish a lot very quickly, could be kind of slow. But that being said, it's not always the case at all places, just my initial experience. And it was more just like I wanted to try something else. And the group I was working with in industry, it actually felt like very much like an academic setting in terms of, how our group operated. Really, I was vetting the people I was interviewing with in terms of like, I wanted to make sure they were doing things on the up and up. Industry kind of gets a reputation for, not being that way, like big pharma. This place, I really got a good impression, and they were letting science kind of drive the research, not letting the dollar drive the research, which is important. I think one of the other panelists mentioned earlier, we're in this as public health practitioners, you want to do your best to contribute to the greater good. You don't want to, make a buck and sell out, for lack of a better term. So that was kind of a long-winded answer, but that's my 2 cents. And now I'm back in academia, by the way.
I totally appreciate that. Thank you. My mindset was my trajectory is to stay in healthcare for about 10 years. And I have a few friends who are working in industry right now in like kind of health tech startups, and then also Microsoft and Google that are building out, their health tech software. But yeah, we don't know where life's going to take us, right? C'est la vie. So we'll see where I end up. Thank you for that answer.
Yeah, no, I totally agree. You could have a plan. It's important to have a plan, but also, have some flexibility. There's no, I think Carmen said, there's no linearity to anyone's path, I don't think. So.
Right. Thank you.
Sure.
A great question that I think you guys can answer is, do you believe that you have a good return of investment on your degree? I guess as far as like getting it, or
I think so. It was very helpful for me, and I think CUNY is a great program. And I mean, if you look at it in terms of investment, financial investment, it's obviously much more affordable than some other places. But I had a great experience. I learned a lot, and it's been very helpful to me personally on a professional level.
Yeah, absolutely. I think one of my primary reasons for attending school was because of how affordable it was. Um, you get a great education for half the cost of um, what you would get at private school, which is essentially the same exact education. So yeah, I completely agree. Um, one question that I want to talk about or bring up, we were talking about this prior to when other students came in, but how important doing research was prior to entering the workforce. And I think Rafaela, if you want to just share what you said to me and kind of echo it to like all the other people that are in the chat right now or in the Zoom.
Yeah, definitely. So doing research was really important. It was a stepping stone. And those skills that I learned with Dr. Joshi, assisting him with research, timely research with COVID-19, we were analyzing dashboards across the United States from different states to see like what worked, what didn't work, and what can be improved on. And that same methodology was something that I could apply in the interventions that I'm trying to currently roll out at NYCH&H. I think that's like kind of high level of it.
Yeah, absolutely. Anyone else? You guys want to share about like research that you did at CUNY or
I think even beyond research, what I would say is for anyone who has the opportunity to be involved either with a research project or even some professional experience kind of while they're doing their degree, it's really, really valuable because you learn at the job and then you learn at school, and it helps you in kind of both areas. And I think CUNY's program is set up in a way that really allows for that. A lot of the classes, at least when I was there, are kind of afternoon, evening-ish. And, you know, everyone has their restraints, but I think right now is a really great time to look for new positions, especially in public health. There's been a huge kind of push in that area, so there should be a lot of opportunities out there. And if you're doing something work-wise that you're maybe not super happy with right now, then why not just, you know, throw yourself out there and see if you can do something that's kind of more related to the public health area and kind of benefit from doing it at the same time, because I think it's so incredibly valuable being able to apply what you learn in school right away at work, and what you learn at work and kind of helping you in school. It's really valuable.
yeah, absolutely. And speaking to that, I'm sure a lot of you guys know you've received these emails, but career services, they'll send out emails every so often, not even just with job opportunities, but with internships, part-time, or even like you know, shorter opportunities that might last like less than a few months. If you're, you know, if you're short on time or if you feel like you're super busy. There's a lot of opportunities that are super flexible that can fit your schedule, and, you know, career services and OEL, they do a great job sharing, you know, a ton of opportunities for you guys to, you know, take advantage of. So definitely look into those emails. I know sometimes we click through our emails, but, you know, look into them, you know, see what opportunities there are and if there's anything that's a fit for you. And you might be surprised with what you see and what you find. You know, it could lead to something better. Who knows? So yeah. And this is something, you know, especially now that we're kind of heading back towards more in person instead of online. In an online format, we're heading towards like more in person courses, classes and whatnot. So if you guys want to share, what are the best ways someone entering the field can start networking? I know earlier, I believe, David, you said that you were a little shy in the beginning and you just started to email folks and reach out. What other ways do you suggest to network?
A couple of ways. I mean, the low-hanging fruit is obviously like LinkedIn. That's immensely valuable resource. But for me, like in person, going to conferences, I'm sure some of the panelists and some of the folks on this call have been to like the New York City Epi Forum. it's like a great place to meet people, your peers, and faculties at different institutions around New York City. So not only at CUNY, you have like Columbia's represented there, NYU usually, folks from my institution. So conferences are definitely a great way to go, and there's obviously many more than that, and a lot of New York's such a big place for public health. There's always things going on. I would encourage like people to just get on listservs. You never know what'll come across your email, and actually read them. I have the temptation to just kind of discard junk email all the time when it's from Columbia or it's from NYU, but it takes 2 seconds to just skim it over. So you never know, you might find something. So just my my initial thoughts, I guess.
Yeah, absolutely. And another great piece of advice that kind of worked for me, I was talking to a friend, like a classmate, a peer, and they were like, oh yeah, the Department of Mental Health is hiring for, and a job's part-time. You can do it when you're in school. I'm doing it. I was like, oh yeah, I could do that. So I quickly reached out to her supervisor, and everything worked out. And that's what I'm currently doing while finishing up my capstone. And, it gives me a lot of flexibility and a lot of time. So not only just through LinkedIn and professors, but also talk to your peers that are kind of working somewhere that you might be interested in, or might have connections to opportunities. It's good to also connect with each other. One of the biggest things that I can share in the chat is that we have a Discord. I don't know if you guys know, but we have a Discord for CUNY SPH. I'll share that. I highly recommend that everyone join it, share it with your classmates, your peers, and, communicate with one another. So, yeah.
It's great that you mentioned that, Uma, because the PHI program was pretty much remote, there was really no chance to go on campus and meet the peers, and then we relied on WhatsApp chats to like communicate with each other. So definitely take advantage of the opportunity if you're on site to meet your classmates, get to know them, and collaborate. Because from one of my classmates, we were taking the population health dashboards class together, and she ended up, after she graduated, working with the test and trace at NYC Health and Hospitals doing data analysis work, and that was such an unforgettable experience for me that it gave me so much momentum and a great platform to be in the position I am now, because the database that they were working with, it was a mess. It really, and I came in with not knowing SQL at all, and I had to learn from scratch. So I think that, again, do not be intimidated. Just really throw yourself out there, and yeah, like everyone's echoing, take that leap of faith, because you never know. The connections that you make in a graduate school will really prove fruitful later on.
Yeah, absolutely. All right, so a couple last questions, and again, you guys can raise your hand if you have any questions. So what were your first priorities after graduating? I know that's like a interesting question, but what were your first priorities after graduating? After maybe like vegging out for a week and like letting your brain like recuperate from all the stress and trauma.
I guess I can go first. I was still working with Dr. Joshi up until I graduated. So I helped launch the newsletter. We did that small scale hackathon for COVID-19 vaccine hesitancy. And then while doing that, I was, doing research, and I was building that experience up. And then I started applying to jobs. And one of the things that proved really helpful was creating a tracker. So I can like keep track of the jobs I applied to, who was that contact person who I spoke to, if I got follow up for an interview with them, and then like what were the necessary skill sets for that position, any programming languages I needed to know. And yeah, really just keeping track on that. That's what I was doing after I graduated. It was not the most fun, but it was definitely a stressful 3 months. But
Yeah, I think I had like an easy transition, because since I was already working in Columbia, they offered me a full-time position. So I just stayed on, and I took a break. I went home. So I'm from the Dominican Republic. So I went home to see my parents. Yeah, I just took a break because it was a lot. It was 2 years working 2 jobs, full-time student. New York City a lot. So yeah, it was a, I guess, peaceful transition into the workforce.
Wilson. Oh, sorry, if you want to go, Marco.
Just really quickly to piggyback on that comment, I think on a larger sort of scale throughout, I mean, I would say young career, but I think it's really helpful you'll have sort of really stressful periods. I also worked during the MPH and I continued working afterwards, but that you do take those breaks. And because I think everyone should, you're always challenging yourself to grow. And we had a couple of questions for growth and reaching the next step and stuff. But you always just got to take a little bit of a breather. And that means maybe just doing, your job and not something after you wrap up every day, and you want to take a breather before and then kind of figure out what you want to do as the next step and then tackle that, but take those breathers.
Yeah, I definitely agree because burning out, it's a real thing. So just like taking the break and, resting. I'm actually looking forward to a break because I haven't had one ever since I started this program because we have to prepare for qualifying exams. And all summer long, I was preparing for qualifying exams, took them in August and had like 1 week off all summer to then start this year. So this summer, it's gonna be my first break since I started this PhD. So I can attest that burning out, it's real. So breaks are very important.
Yeah, I agree. Wilson, message in the group chat. For panelists who applied to PhD programs or are planning on applying to PhD programs, did you face any challenges in your candidacy through graduating with an MPH compared to other candidates with an MS degree?
Could take that one. I don't think it necessarily matters, for at least in my experience. As long as you're demonstrating that you're a strong applicant, in my experience, they've been viewed as equivalent degrees, but I'm not sure if the other panelists have had the same experience.
I would say since you said you were interested in biostats, so for me, in an MS for biostats, there's classes that you like more math intensive classes, of course, because it's a master's of science. So like people within MS, they might be able to skip those courses, like their first year. I had to take them all because I did have a background in math from undergrad, but I graduated undergrad in 2014. That was like, I was like, what is calculus? So like I did like all the coursework that you're supposed to do your first year, but I did not have to take any, because I'm in a school of public health, you have to take like core requirements. So like you have to take epi and like stuff like that. But I already had a master's in epidemiology. So like I didn't have to take that. And so a lot of my peers, even if they had an MS, they had to. So that was a plus. But like for the more mathy courses, yeah, they don't count it. And I think I even shared the syllabus from classes and the books that we used. And I still had to take the classes. That was the only thing. But in terms of like getting into the program, it actually looks very good in your application to have like a master's in public health. So yeah, because then like you have a lot of applied knowledge, basically.
Thank you. That's a relief.
So this is a question not only for panelists, but for everyone and anyone who wants to share. What are some challenges you face as a graduate student and how did you overcome those challenges? So if anyone wants to jump right in, you can raise your hand or you can just speak up. Or if you guys are facing any challenges that you want to discuss.
I can kind of chime in. So This is my last semester, and I come from a low income, first generation immigrant background, as most CUNY students do. So I found it incredibly challenged to just kind of juggle a full-time graduate course load while working at the same time, and also like making money to maintain a lifestyle in New York City. So I was like incredibly hard on myself. So I just had to like take a step back and remind myself that I am doing the best that I can, and it's okay to struggle. So that's really what helped me get through. And it's like 2 months away from finishing all my grad classes, and it's like feels surreal to be here right now. So yeah.
Yeah, you made it a long way, but that is a super challenging, thing that you faced. Just I feel like we put so much pressure on ourselves, and sometimes that could kind of impact us in a negative way if it's too much pressure. So I'm glad that you have that little angel on your shoulder saying it's okay to, whatever it is, like if it's make mistake or if you're not perfect. I think that's a great reminder to everyone. In the chat, someone mentioned, Rafaela mentioned having to learn certain things from scratch. Was there anything you wish you would have? And oh, sorry, this is so we'll get to your question. I'm sorry, but does anyone else have anything to add about challenges that they faced during their graduate program or?
Yeah, I can just add, because the population health informatics program was new, there was an uncertainty of like the curriculum and what we were going to face. So a lot of time I'd have felt like we didn't know what to expect. And there weren't a lot of professors at the time teaching the courses. In the beginning, Dr. Joshi was teaching everything. It was like teaching 2 or 3 classes. So then he started bringing other professors on board to help with teach the courses. So I think that was one of the biggest challenges, not knowing what was going to happen. And I think just to echo to kind of answer a little bit of the question that Ingrid asked, one of the things that the PHR program wasn't really robust in, it was data, having the students develop those data analytical skills. And then we started doing that in the end of the semester. That was in the fieldwork class. So where we created our, we started working on our thesis. And essentially we learned like 1 or 2 weeks, SQL, R, Python, but just for small projects to start in building a portfolio. But I know that the EPI student maybe have a semester for a language, a programming language. So I think that was also something that would have been different for the PHR program, make it more robust. And Dr. Joshi did his best to put that at the end, because for the most part, everything was theoretical.
I think for me, one of the challenges was just the online format was super hard for me. Kind of, I'm more extroverted. I like to talk to people in person. I feel like I learn best in person. It was just overcoming the online format and everything being relayed to you in emails, or, like a message or, on Zoom when there's so many distractions at home. So I think one of the most important things that I learned during my graduate degree is, especially for your capstone, for your proposal, try to get that out of the way as you're doing your field work, figuring it out as you're kind of, as you're going along with your field work. So you're not waiting last minute to get approval, and you can get into the class with like an easy transition. You have enough time to discuss with your faculty advisor. We kind of hear these things, professors and, the fieldwork office and everyone kind of like, they say it to you, but it doesn't really register until you got to be the person to hand it in before midnight or whatever it is. So what I recommend is, just staying on top of your fieldwork and your capstone, because those are 2 crucial classes that you need to graduate. And you want to do well for those, and you want to, produce something that, you're proud of, and maybe one day it can get published. So that's my advice, just staying on top of like the emails and what your requirements are of your program, because it's easy to just get lost in, junk mail, or just collect, or you just quickly, click it so you don't have a notification. So that's my advice to everyone.
I guess I wanted to add, just going off what Kit was sharing. Basically, like work-life balance, it's a challenge. Like it was a challenge when I was doing my master's, because again, working, being a full-time student, but now in a PhD program, like it feels like there's not enough time in a day to do like coursework, homework, be on top of my research, and then be on top of like other things that I want to do, you know? So definitely like time management, just it's like super, super important, but it's also very hard to master it. I'm still struggling. So that's one thing. And just going off what Kit was saying, just like giving yourself grace, like, yes, like there's all these things that you want to do. And of course, we want to do them the best in the best way that we can, but also recognize that, you know, like we're a person first and we have to take care of ourselves and like, yeah, like not like push ourselves, yes, but not to the point where like we get like burnt out, because then we can't really do anything at that moment, you know? But yeah, definitely giving yourself grace sometimes and just like taking the break if you need it. That's something that I've learned the hard way. And yeah, but yeah, time management. And I guess for me right now, one problem I've been having, and I feel like this happens a lot to a lot of grad school students, is not something that I guess like people don't talk so much about, but just like, you know, that imposter syndrome, just like feeling like you don't belong in that space, and just having to like remind yourself. Like I remember, Uma, you were saying like when first you started doing the epi bios, like when you saw, you know, the programming and all of that, like, you know, but you took the leap of faith and here you are, you know, just like that feeling. Yeah, it comes and goes, but just like knowing that you belong where you are and like you are where you're supposed to be, and just, you know, keep working hard, but also take care of yourself.
Absolutely. I think everyone has different ways of kind of taking care of themselves and or even just getting themselves to the next step, or, you know, the next assignment or the next project or the next goal. And there's so many different things that might work for me that might not work for you guys, but try to find those things now, or, you know, whenever you get the chance, just see what works for you. You know, if there's a day where you're not feeling productive, you know, just tell yourself, all right, I'm going to do 5 minutes of work, instead of psyching yourself out and saying, oh, I have this huge project to do. Just say, I'm just going to do 5 minutes and see where that takes me. Or, you know, kind of develop little tricks to get you over that hill or that bump or whatever is stopping you from getting from point A to point B. Because, you know, life is hard. You know, we got to find ways to push ourselves forward. So if you can figure it out now and, you know, ask others for help, ask our panelists right now what they did, or whatever it is, then yeah, it'll take you a long way. And I'm still doing that myself. I always tell myself, just do 5 minutes. If I'm like feeling lazy or whatever, like just do 5 minutes. And then I find myself 3 hours in just working away at like 2 a.m. in the morning. So yeah.
Something I was gonna say, because I know you were mentioning that you guys have like classes online, going back to school now. But something that I realized that worked, it's online, but like it still works, is having accountability groups, even if it's through Zoom. So like I recently, like I did that during winter break. Like I joined this group where basically from like 9 a.m. to like 10:30, it's just like you do like an hour and a half of work. You go into the Zoom, and everybody goes around and says like what is it that they want to accomplish in the next hour, but they have to be like realistic goals, right? And then the moderator, or like the person guiding the group, like they'll tell you like, do you think that's like something you can do in an hour? So, you know, so you set realistic goals for yourself, and then just everybody in the Zoom like goes and does their work for 1 hour, camera on or off, and then you come back and you report what you were able to accomplish. And I think that was like very helpful. It also helps you like interact with other students. Yeah, and I tried it, and actually the week that I did it, like in 1 hour, I was so productive. I was like, what is going on? This is magical. But yeah,
Yeah,
super.
absolutely. So we're coming to the end of our program, and I want to thank you guys, the panelists, for being here with us tonight, and to everyone that joined and listened in. To close us out, if you guys, our panelists, want to just give, share your final thoughts or any words of wisdom or any last things to say before we wrap up today.
No, just obviously wishing everyone who's in the program currently the best of luck, as well as the panelists and yourself, Uma. So yeah, I just echo what all the panelists said. It's really important to pace yourself and factor in time management, but don't be too hard on yourself. Clearly, everyone on this call is like very driven. And you don't want that to be to get in the way of your mental health. And if you have to graduate like a semester later, it's not the end of the world. It'll still work out.
Yeah, the best of luck to everyone. I think we all collectively are in an interesting, exciting field, and it'll be good to see what the future holds. Things can only get better from where we come from with the pandemic.
If you decide to pursue the population health informatics, you're in for a roller coaster of great experiences. I learned so much, and now my manager was like, I think you need to treat this role as if you were in grad school again. So now looking at it like that, with more of an informatics lens, I can see the good that I can do with a degree. And what I will say as well, once I graduated, the Fire Club kind of ceased to exist. So if you want to bring it back, that would be something I can help with, behind the scenes, doing these kind of talks, facilitating, getting my peers from the program previously who graduated to come for these talks as well. And I think, yeah, really creating that community is something that I always advocate for. So thank you.
Yeah, I just want to say the same. Good luck to everybody that's graduating this year, graduating soon. And yeah, and I think Maya, it's gonna share everyone. I don't know if everyone's email, but like if anybody has questions about like, I don't know, PhD programs in biostatistics and stuff, like I cannot promise that I would have a lot of answers because I didn't apply to a lot of schools either. So, but like, I went through the process and yeah. So if any questions, I think she's sharing our emails. So yeah, feel free to reach out.
And I hope it's okay with you guys, but maybe if anyone in the Zoom wants to perhaps connect with you on LinkedIn to discuss more or see if there's, any other questions that they might have to send your way, if that's all right with you guys. Maybe everyone can connect on LinkedIn. I know I will. So yeah, on behalf of CUNY SPH, we just want to thank everyone for coming out tonight. And we hope that the panel was insightful and encouraging. If you're a current student, don't forget there are many resources available for you navigating your public health career. And just reach out to the career services office and let them know, like, hey, I want to practice my interviewing skills, or hey, how do I negotiate my salary? I think Kit threw that in the chat, or whatever it is, they're there to help you. And for potential students, feel free to contact the Office of Admissions for any other information you may need. Staff will be in the main room for a few minutes if you have any questions. And if you guys don't mind, just complete the survey that will pop up once we end tonight. And we hope to see you all again. So have a good evening, everyone, and thank you again.
Yeah, thank you guys. Take care.
Thanks.
Thank you.
Thank you. Have a good
Bye,
night.
guys. Hope to see you guys again in the future.